Welcome to our presentation on the experience of Admiral nurses during the COVID-19 pandemic. COVID-19 is a pandemic that has meant people across the world have had to make huge changes in their lives and ways of working. My name's Gayle Madden and I'm a practice development facilitator. At Dementia UK, we support Admiral nurses, specialist dementia nurses, to maintain their specialism, developing their knowledge and skills and promoting evidence-based practice. The nature of the pandemic meant fast-paced action was required, and like others, Admiral nurses had to adapt in this ever-changing environment. The aim of our research was to explore the experience of the Admiral nurses during the first wave of the pandemic in order to learn about individual experience and explore how those experiences impacted on the Admiral nurse themselves and their practice. We used semi-structured interviews to explore Admiral nurses' experience and completed these online using Microsoft Teams. Admiral nurses from a variety of settings were approached with the hope of getting the views from different perspectives. We analysed the data following a thematic approach. So ultimately, we recruited 19 Admiral nurses, all of whom were female. Their ages ranged between 32 and 54 years old, and years as an Admiral nurse from 12 months to 14 years. Three overarching themes depicted a journey that Admiral nurses negotiated during the first wave of COVID-19. These were temporary impotence, processes of transition, and a new world. Sub-themes within each of these were also identified and can be seen in this slide. For the purposes of this presentation, I'm going to focus my time on the first of our themes and the sub-theme, I'm no longer a real nurse. A sense of impotence and paralysis was experienced by Admiral nurses and was compounded by feelings of uncertainty around their role and identity. The nurses described how they would normally work with families visiting people in their own homes, but this changed significantly with the majority practicing remotely. Because of this, many felt they were no longer a real nurse because they weren't out there with colleagues on the COVID-19 front line, or because their usual way of working was inhibited by COVID-19. The feeling of no longer being a nurse generated a sense of inadequacy. The nurses viewed their role in a certain way, which meant they felt unable to meet the needs of families affected by dementia. Not being able to physically be with the people they were supporting, providing face-to-face care, created high levels of anxiety in some Admiral nurses. There was a strong belief that the lack of physical presence meant they were less effective in their role, with some nurses expressing feelings of imposter syndrome. Imposter syndrome is often felt when exposed to a new professional work setting, and for the Admiral nurses, these feelings were manifested due to a sense of the unknown generated by the pandemic. They faced a new work environment where their long-standing skills and knowledge were greatly tested. This led to lower self-confidence and belief in their own abilities. As the COVID-19 restrictions continued, there was a gradual realisation that families seemed to be coping with the situation better than the nurses had anticipated. The nurses were still able to provide expert knowledge and meet the needs of the families, albeit remotely. However, with this came the realisation that a family's need for information to enable them to manage situations was the overriding need, not necessarily the nurse themselves. And this made the nurse feel acutely dispensable. So despite transitioning from this temporary state of impotence to learning and practicing remotely, recognising the strengths of this type of approach, the belief that face-to-face visits are most effective way of working remained core for the majority of the Admiral nurses. However, there was also a recognition that the adaptation in their professional practice proved an effective support for families living with dementia and could be a method used in future care delivery. So, during the first wave of the pandemic, the Admiral nurses were required to swiftly move from their usual mode of care to virtual support. And as we've heard, this challenged their perceptions of what they considered real nurse activity. Recommendations from this research focus on Admiral nurses, however, can be considered for other nurses working in this way. I want to highlight the importance of promoting resilience whilst supporting nurses in their ongoing adaptation and acceptance of working differently. And this includes finding ways to help develop their confidence. And finally, we've considered further research. Things could be undertaken to understand the experience of remote working from others' perspectives and how the Admiral nurse role change impacted on them. So, for example, families with dementia and other health and social care professionals. Thank you for listening.